Good morning. Today I am starting a topic especially for the students of MBBS and also for PG students in ENT. I am starting a lecture series. First will be on the anatomy of the ear, and the first lecture will be on the anatomy of the external ear. So looking at the ear diagram, you can see that the ear itself has got three parts. One is external ear, another is middle ear, and the last one is the inner ear that you can identify in the slide that I'm giving on the side. That outer ear is also called the external ear, and the middle ear, and the inner ear. So the human ear is divided into these three parts: external, middle, and the inner ear. So the external ear is the outer ear, which is visible part of the ear. The outer ear comprises a cell-like protrusion from each side of the head and a canal through which sounds travel, and the eardrum membrane that we call as the tympanic membrane. The eardrum membrane is also called the tympanic membrane, and it consists of three parts. The external ear is consisting of three parts. One is the pinna, that is the auricle, then the external auditory canal, and the tympanic membrane. Okay, these are the three parts that we'll be discussing in this lecture. So this is the pinna that you can see. Here we have got different parts of the pinna. Starting from the above, you have the helix, which is the outermost structure, that is the helix elevation, and just below will be a scaphoid fossa, that is the scaphoid fossa. Then we have the crura of the antihelix. So helix, after that, just below that we can see the antihelix, and there are crusts of the antihelix, that two crusts that you are seeing, that we call as a crura of the antihelix. Then we have the triangular fossa, which is between the helix and the antihelix in the anterior part. Then we have the concha or the cava, that is leading to the external auditory meatus. And we have tragus, which is the most prominent protrusion here in front of the external auditory meatus. Then we have the lobule, which is hanging below lobule. Okay, so the external ear, we have the auricle, which is a yellow elastic cartilage covered tightly with skin. And auricle is the most visible part in the outer ear that you can see just from the front. It varies in size and shape from person to person. The funnel-like shape plays an important role in gathering sound waves from the environment. The auricle is made of cartilage with a number of twists, turns, and indentations that I have just told now. The cartilage is covered with skin. The bottom portion of the auricle is lobule or ear lobe. So the external canal, the outer rim of the auricle, is the helix that I've already told. Then the antitragus is above the lobule. Okay, then antihelix is the elevation, which is close to the center of the auricle. Okay, this is the antihelix, close to the center of the auricle. The above is the helix. Then here is the tragus, and here is the antitragus. Is the elevation that is close to the center of the auricle is the antihelix. Then antitragus is just above the lobule. This is the lobule. Just above the lobule we have the antitragus. Okay, and a small triangular protrusion which points backwards and forms the anterior portion of the auricle, is called a tragus. Then the depression of the tragus into the opening of the external ear canal is an efficient means of blocking sounds. So for example, if you press upon the tragus, you can easily block the sound coming from outside by blocking the external auditory canal. So tragus is being used by pressing on that to occlude the sounds coming from the outside. To the external canal, the occlusion is more efficient than plugging the ear with a finger, clasping hands over the auricle, or even using some earplugs specifically designed for sound attenuation. So just pressing the tragus over the auditory meatus blocks the sound. Then the middle portion of the outer ear before opening the head is called the concha. So this is the capped out portion is called the concha. The concha is bowl-shaped and is divided into the lower cavum concha and the upper cymba concha or cyber concha. Okay, so the lower cavum concha and upper cyber concha, the concha is divided. The auricle is more efficient at delivering high frequency sounds than low frequency sounds. It helps on localization of sounds delivered to the head. So you can see in the human being we don't change the position of the pinna, but you can see in a cat the pinna's position is changed so that he can focus or it can focus the sound coming from different directions. As such, the auricle in the human being also, they are used for localizing of the sound from the source of the sound coming from any direction. So the external ear, there is no cartilage between the tragus and the crus of the helix. So this is the tragus and this is the crus of the helix, and there is no cartilage, and this area is called incisura terminalis. An incision made in this area will not cut through the cartilage and is used for anaural approach in surgery of the external auditory canal or that of the mastoid. Pinna is also the source of several graft materials for this surgeon. The cartilage from the tragus, the perichondrium from the tragus or concha, and a fat from the lobule are frequently used for reconstructive surgery of the middle ear like tympanoplasty. The conchal cartilage has also been used to correct the depressed nasal bridge, while the composite grafts of the skin and the cartilage from the pinna are sometimes used for repair of the defects of the nasal ala. Okay? Now the external ear, the external auditory canal or the external auditory meatus is a tube formed in the side of the head which begins at the concha extending inward at a slight upward angle for approximately 24 mm in adults. The external auditory canal is elliptical in shape and averages about 9 mm in height and 6.5 mm in width. The outer portion of the external auditory canal passes through cartilage. The skin of the external auditory canal supports several set of glands such as the sebaceous glands. It is not a straight tube. The external auditory canal is not a straight tube. Its outer part is directed upwards, backwards, and medially, while its inner part is directed downwards, forwards, and medially. Therefore, to see the tympanic membrane, the pinna has to be pulled upward, backward, and laterally so as to bring the two parts of the alignment. The canal is divided into two parts. One is cartilaginous and another one is bony. And you can see here is the cross section of the external auditory canal, and the outer part, you can see the outer 2/3 is made of cartilage and inner bone, inner 1/3 is lined by bone. Okay. Now the sebaceous glands secrete an oily and a fatty substance which is called sebum. The major product of these secretions is earwax or cerumen. The cerumen exits the ear naturally when the walls of the external auditory canal are distorted by movement of the jawbone during chewing or speaking. So this movement during chewing and speaking, it relieves the external ear of its wax. The outer third of the external auditory canal contains a number of hair follicles. The cerumen in hairs helps to keep foreign objects from passing into the inner two-thirds of the canal. So to say, the inner two-thirds of the canal are protected by the outer one-third. So the inner area of the external auditory canal passes through the tympanic portion of the temporal bone. There are no glands and hair in this area, and usually no wax is secreted in this area. The two portions of the external auditory canal meets at the osseo-cartilaginous junction. The condyle, which is a protrusion of the mandible, comes to rest just below the osseo-cartilaginous junction when the jaw is closed. If the mandible overrides its normal position, the condyle will press into the junction, causing pain, and this pain is called the temporomandibular joint or tralgia. So if the mandible overrides its normal position, the condyle will press into the junction, causing pain, and this pain is called the temporomandibular joint or tralgia. And patients usually come with this complaint, especially to the ENT doctors. The external ear angle is different in small children as compared to the adults. The canal angles downward rather than upward and is a more acute angle. So the children's ear can be examined from above the head because of the above region, or it can be pulled downwards to see into the tympanic membrane. Now the cartilaginous part, it forms 1/3, which is 8 millimeter of the canal. So cartilage is a continuation of the cartilage which forms the framework of the pinna. It has two deficiencies, the fissures of Santorini in this part of the cartilage, and through them the parotid or superficial mastoid infections can appear in the canal or vice versa. The canal covering the cartilaginous canal is thick. The skin covering the cartilaginous canal is thick and contains ceruminous and pilosebaceous glands which secrete wax. Hair is only confined to the outer cartilaginous part of the canal, and therefore furuncles, staphylococcal infections of the hair follicles are seen only in the outer 1/3 of the canal. The bony part, it forms about 16 millimeter, that is the inner 2/3, and the skin lining the bony canal is thin and continuous over the tympanic membrane. It is devoid of hair and ceruminous glands, so about 6 millimeter lateral to the tympanic membrane. The bony meatus presents a narrowing called the isthmus. So this is the isthmus, and foreign bodies lost medial to the isthmus get infected and are difficult to be removed. So anterior-inferior part of the diff meatus beyond the isthmus presents a recess called the anterior recess, which acts as a cesspool for discharge and debris in cases of external and middle ear infections. Anterior-inferior part of the bony canal may present a deficiency, that is foramen of Haskell, in children up to the age of 4 or sometimes even in adults, permitting infections to and from the parotid. And this is the tympanic membrane. As you can see, there is a short process of the malleus and the pars flaccida above, and from the short process of the malleus on either side you can see the folds, anterior and posterior fold. Then you have the annulus of the tympanic membrane. Then the light reflex can be seen from the handle of the malleus downwards from the umbo, and the pars tensa is all around. The tympanic membrane. The external auditory canal ends in a concave disc-like structure called the tympanic membrane. It is also called as eardrum. The tympanic membrane acts as border between outer ear and middle ear. The total area is about 63.3 millimeters square. It is constructed of 3 layers. The outer layer is osseous. The middle layer is tough, fibrous, and connective tissue. Now, which contributes most of the membrane's ability to vibrate and the impinging sound. So the middle ear space behind the tympanic membrane is lined with mucous membrane, including the 3rd layer of the tympanic membrane. The tympanic membrane is thin, averaging about 0.07 millimeter in its thickness, and the movement of 1 billionth of a centimeter is sufficient to produce a threshold response in normal hearing individuals in the 800 to 6000 Hz range. And tympanic membrane forms a partition between the external acoustic canal and the middle ear. It is obliquely set, and as a result, its posterior superior part is more lateral than the anteroinferior part. It is 9 to 10 millimeter tall and 8 to 9 millimeter wide and 0.1 millimeter thick. The tympanic membrane can be divided into 2 parts. The pars tensa, it forms most of the tympanic membrane. Its periphery is thickened to form a fibrocartilaginous ring called the annulus tympanicus, which fits in the tympanic sulcus. The central part of the pars tensa is dented inwards at the level of the tip of the malleus and is called umbo. A bright cone of light can be seen radiating from the tip of the malleus to the periphery in the anteroinferior quadrant. The pars flaccida, or the Shrapnel's membrane, it is situated above the lateral process of the malleus between the nodes of Rivinus and the anterior and posterior malleolar folds, earlier called the malleolar folds. It is not checked out and may appear slightly pinkish. Various landmarks seen on the lateral surface of the tympanic membrane. Now, layers of tympanic membrane. Tympanic membrane consists of 3 layers. The outer epithelial layer, which is continuous with the skin lining the malleus. The inner mucosal layer, which is continuous with the mucosa of the middle ear. The middle fibrous layer, which encloses the handle of the malleus and has 3 types of fibers. They are the radial, circular, and parabolic. And as you are seeing here also, there are some transverse fibers. Okay, the pars flaccida having very few of these middle fibrous layers, and the rest you can see in the pars tensa. It is profusely supplied by all these fibers. Now, relations to the external acoustic meatus. Superiorly, we have the middle cranial fossa. Posteriorly, the mastoid ear cells and the facial nerve. Inferiorly, the parotid gland. Anteriorly, temporomandibular joint. And posterior superior part of deeper canal near the tympanic membrane is related to the mastoid antrum. Sagging of the area may be noticed in the acute mastoiditis. And here you can see the relations of the external acoustic meatus more clearly. So you can see all these structures related to the middle ear in this, related to the external ear in this picture. Now, the nerve supply of the external ear. You can see the pinna, the supply of the pinna by greater auricular nerve, facial nerve, and auriculotemporal nerve. And you can find the auriculotemporal nerve serving more anteriorly, and posteriorly you'll find a great auricular nerve, and around the concha you'll find a facial and vagus nerve. And from behind, if you see, the lesser occipital nerve supplies the upper part, and rest are supplied by the great auricular nerve, and usually much medially the facial and vagus nerve supplies. Likewise, the nerve supply of the external auditory canal will be the anterior wall and roof will be auriculotemporal, the posterior wall and floor will be the auricular branch of the vagus, and posterior wall of the auditory canal also receives sensory fibers from the cement cranial nerve through the auricular branch of the vagus. And in herpes zoster aurticus, lesions are seen in the distribution of the facial nerve, that is concha, the posterior part of the tympanic membrane, and the post-auricular region. So these are the areas which will have vesicles in the time of herpes zoster aurticus. Now, the nerve supply of the tympanic membrane will be anterior half of the lateral surface by the auriculotemporal nerve, the posterior half of the lateral surface is the auricular branch of the vagus, and the medial surface, that is tympanic branch of the ninth cranial nerve, that is Jacobson's nerve. Development of the pinna. The first branchial cleft is the precursor of the external auditory canal, and around the 6th week of embryonic life, a series of 6 tubercles appear around the first branchial cleft. They progressively coalesce to form the auricle. Tragus develops from the tubercle of the first arc, while the rest of the pinna develops from the remaining 5 tubercles of the second arc. The faulty fusions between the first and second arc tubercles causes preauricular sinus or cyst, which is commonly seen between the tragus and the crest of helix. By the 20th week, pinna achieves adult safe. Initially, the pinna is located low on the side of the neck and then moves on to a more lateral endocranial position. Now, development of the external canal. The external auditory meatus develops from the first branchial cleft. By about the 16th embryonic week, cells proliferate from the bottom of the ectodermal cleft and form a meatal plaque. Recanalization of this plaque forms the epithelial lining of the bony meatus. Recanalization begins from the deeper part near the tympanic membrane and progresses outwards. That explains why deeper meatus is sometimes developed while there is atresia of the canal in the outer part. The external ear canal is fully formed by the 28th week of gestation. Next, development of the tympanic membrane. Tympanic membrane develops from all 3 germinal layers. The outer epithelial layer is formed by the ectoderm, the inner mucosal layer by the endoderm, and the middle fibrous layer by the mesoderm. So this ends the lecture on the external ear. So I have covered almost all the parts of the anatomy of the external ear, starting from the structures, development, nerve supplies, and relations. This ends today's lecture. Okay, bye-bye.